Hello, everyone. Welcome to Health Talk Show. I'm Dr. Farhan here, joining you from Philadelphia. Today's guest is Dr. Ari Bernstein, a friend that I know from CovidMD and Fruitstreet. He is a physician who wears many hats. And Ari, I would like to welcome you. How are you doing?
Great. Thank you so much for having me. I really appreciate you having me on. And it's been great getting to know you.
Ari, I have to say that since CovidMD, the project of Fruitstreet has started, you have been a great source of energy, optimism for this company. And I want to thank you because we are connected through that project and with 500, 400 other physicians. We'll get into COVID MD a little bit later, but I want to ask you about your decision to become a physician. I know you're a lifetime New Yorker, so but what brought you to become a physician?
So it's pretty interesting. Growing up, I was always interested in science. Like science was my number one love. I also loved animals. I was always like an absolute animal lover growing up as a little kid. And I actually wanted to be a veterinarian originally. My dream actually as a little kid was to go to veterinarian school. And that was the plan. And I actually volunteered in and worked in an animal hospital uh, very early on in college for about 3 years. But I saw sides of it that I decided to go to medical school was a better route than veterinarian school for multiple different reasons.
Yeah, I saw that Selmer's Animal Hospital.
Yeah,
Um, and where did you go for your research? You started getting into science and research, and you
yeah,
maybe in New York area you were doing some
yeah.
research as a student.
Yeah, so, well, first it started out, my uncle is an oncologist. He specializes in lung and esophageal cancer at Columbia Presbyterian.
Hmm.
So, so he was there, and there were obviously the world's leading experts are there. So he got me into in the lab where they were doing some of the top immunology research in the world. So I volunteered there for a summer, working with some of the top world leading experts in immunology, doing some genetic research. And for a young kid that's only, I don't even, what was I, like 18, 19, being around those type of people and those minds, those brilliant minds at that age, it's just an amazing experience. I mean, it was way over my head, but it was just unbelievable experience.
Yeah, it gives you a sense of direction, and sometimes it's overwhelming. You worked on
Yeah.
Human Genome Project. Uh,
Yeah.
isn't that the one that billions of dollars were spent in to try to discover human genome?
So basically, my cousin actually worked on a human genome project.
Okay,
So
okay.
my cousin's wife worked on it there at Cold Spring Harbor Laboratory. So she was working on it, and at the time I was in college, and I asked her, "Hey, can you get me in there to
Yeah.
come at least just hang out? Like, even if I can't do anything, could I just see what they're doing? You know, because at the time it was the biggest thing in the news, it was the biggest thing in the world. And she's like, "Yeah, definitely, no problem." So I spent, I don't know if it was a couple of months or a whole summer there in the labs, assisting them, watching them, looking at the computers, helping the research assistants. And it was a really, really amazing experience just seeing and being exposed. Like, once again, being exposed to all these brilliant minds, it makes you a visionary. Like, it makes you see forward thinking. It makes you become a forward thinker.
Yeah, so that influenced your thinking process. And from there, I guess
Yeah.
you joined medical school. You went into medical
Yeah.
school. Um, how was that life? Where did you go for medical school, and how was life in medical school there?
Well, I went to St. George's University in Grenada, and it was tough. It was tough. I'm not gonna lie. I had top grades, top research, top everything. I took the MCAT the first time. Unfortunately, I basically, to be honest, I didn't study. I didn't take it serious enough. I didn't really know how hard the MCAT was, to be
Yeah,
honest with you.
sometimes we just
I,
don't know how to
I
put it.
had
Yeah.
no idea. I had no one helping me. No one, I wouldn't say no one helping me, but no one was really telling me, like, listen, this test is really that serious. Like, I was going fishing when the
Mhm.
MCAT was coming up the first time. Like, because it was the summertime. I was a young kid. I was like, and actually the practice exams, I was crushing the practice exams. The practice
Yeah.
exams, I was getting really high scores in the practice exams. So I was like, oh, I'll just walk into this. I mean, I studied a little bit. I took Kaplan course, studied a little bit, did well in all the Kaplan practice exams. I'm like, oh, I'll just walk in and like whatever. I mean, I'll do great. And I don't know what happened that day. Maybe I just had a bad day, but it killed me.
So, how was life in Grenada in the medical school? I believe you spent like usually 2 years in those type of schools, and then you come back to the United States for your clinicals.
Yeah, I spent 2 years there. And then I came back and did my clinical rotations 2 years back in New York.
Yeah,
And I mean, I can go into a lot of depth. It depends how much depth you want me to go into. But the 2 years there were very difficult. It was not a joke there, I can
the
tell you that.
study was really tough, huh?
Yeah, yeah, it was
Um,
very intense.
and when you finished your medical school, you decided to become a resident. And did you
Yeah.
go to LIJ, Northwell? Where was your residency?
My residency was at the time, it was called New York Hospital Queens, which was
Okay.
affiliate of Cornell Medicine or
Hmm.
Cornell Medical School.
Yeah.
Now Columbia bought it out. Now it's a completely bought out by Columbia now. Now it's called Columbia Hospital. What is it called? New York Presbyterian
New
Queens
York
is now.
Presbyterian, yeah. Because
It's had so many names over the years. So
yeah,
now it's called
it's
New York Presbyterian. It used to be called Booth Memorial too back in the day.
so
So
Ari, both of us have one common thing. We went to New York programs for residency. I was at hospital used to be called New York Downtown Hospital, which was next to
yeah,
Chinatown.
yeah,
And I'm sure that right now there are a lot of stresses in that hospital's shoulder with the COVID-19.
yeah.
What was the type of population that was prevalent in Queens in that hospital? Was there a specific group of people that was nearby that you were catering to?
There was like as you know, Queens is extremely diverse.
Yeah, it's very
Queens
diverse place. Yeah.
Queens might be one of the most diverse areas in the country, maybe. So it was just, I mean, it's good exposure, I would say, for a physician because as opposed to working, somewhere out in the middle of the country where you might only see one population, I was exposed to everything you could possibly think of from every sides, economic backgrounds, um, racial backgrounds, um, ethnic backgrounds, languages, like you name it, I saw it.
Yeah,
So
and people say if you make it here in New York City, those hospitals, you
yeah,
can make it everywhere. And I see your
yeah,
CV, you have done pretty much every part of medicine that internal medicine physician can do. So you went into internal medicine, then you
yeah,
graduated,
yeah,
and you worked as an emergency medicine physician, maybe as a moonlighter, or did you
yeah.
take it as a full-time job? What was your first job when you graduated?
My first one was, it was funny because we're all my friends, well, there was about, our class was maybe 20 to 30 of us graduating in internal medicine. And I mean, some of us were going on to fellowship, the other ones were all scrambling. What are we going to do next year? What are we going to do? Who's signing here? Who's signing where? So we're all scrambling to get a job, not scrambling, but, trying to figure out what we want to do
What
next
we
in our
want to
life.
do life? Yeah.
Yeah. So I was offered a position from North Shore LIJ, now it's Northwell Health, as a hospitalist, a nocturnist actually, for overnights
Yeah.
for four nights over a week in a very wealthy area on Long Island. And basically it's a community hospital where I cover the ICU, cover all the hospital admissions, teach and work with family practice residents, cover the rehab floors. But I mean, some nights it was so quiet that literally nothing went on. And some nights you did 11 admissions, patients crashing in the ICU, problems on the rehab floors, the ER is crazy. It was just such a variation. You never knew what was going to happen.
I know it must be really tough by yourself alone running the ICU. I know I mean your training prepares you, but sometimes you want to have another person, and say,
Yeah.
well, just run it by you. So I'm sure a lot of physicians who are like you, who go through that rough time right at the beginning, it makes them such a sound physician eventually. What your journey during this early physician career, what it taught you? Was there anything that you can now say, well, this was good that I got out of that? Any unforgettable moment?
Well, I'm not sure how many people are aware of this, but so I worked, it is a very long story, so I'll tell it really short. But I worked there so, you graduate residency in July, right?
Yep.
So no, June, well, end of June, July. So I started in July right away. I took like 2 weeks off, started right away, which probably wasn't the smartest thing. But I started right away. I worked there for a year, and then I was going to go into a private practice in that area. They
Hmm.
offered me to go into a private practice that area. I actually was about to sign the contract. I was really thinking about it, and I was going to do it. And I ruptured a disc in my back.
Oh,
I ru-
wow.
and I ended up having 4 back surgeries, a spinal cord stimulator placed, and I was out of work for 5 years.
I did
So
not know that. And
yeah,
was it because of an injury, an accident, or just bad luck?
it's a long story. That's
Okay.
probably outside the
Outside
scope
of
of
this, what,
yeah.
so
So
you came back to work. What
yeah,
would you like to share? What did you do during that time of when you were
yeah,
out of work?
sure. It was a long process. I mean, at first it was just a lot of denial. All the doctors were telling me I was never gonna work again. I was never gonna walk normal again. I couldn't take care of my kids. I couldn't I had a 1-year-old son, and my wife was pregnant with my daughter. My daughter was born between my first surgery and my second surgery. When she was born, I couldn't hold her. I couldn't feed her. I could barely stand on one leg. I was in so
Wow.
much pain. I really didn't want to live anymore. I'll be honest with you, because I was on such high doses of narcotics that you couldn't even believe, and it still was doing nothing. So then I had the second surgery, a couple of months later, and they cleaned up the discectomy, took out pieces of disc. They put me on tons of steroids, and I was in the hospital on steroid drips and everything. But I didn't get better for whatever reason. I just didn't get better. And then they told me I needed a spinal cord stimulator. So I saw the top specialists in the world. You name it, I saw them. I don't want to name names on the podcast, but I saw the top specialists in the area that take care of all the famous athletes, everybody. I just don't
Mhm.
want to. I would rather not name names,
Yeah, yeah.
and they all told me, like, listen, you need a spinal cord stimulator. That's it, and you probably won't work again. I mean, as far as walking normal again, it doesn't look great, but we don't know, So at that point, I was like pretty down. So I did, and then the story goes on, but eventually, I went on through outside the scope of this conversation probably, but I made a miracle recovery through. I made a really miracle recovery. If you saw me right now, you wouldn't even know I had one surgery. You came and tell
Wow.
it. You won't know I had a single surgery. I just had my 5th surgery. I just had my spinal cord stimulator battery replaced a couple months ago. I barely even use the spinal cord stimulator anymore. And I'm off pretty much all medication.
My gosh, it is. I have to tell you, my neck has been hurting for a few days, and I've left arm a little bit numbness, and I'm like, what do I do? Do I go and put a knife in there or something? And you went
Yeah,
through so much for such a long time that must have made you the energy, the strength, the resilience that you have, that you display into your day-to-day life on the forums that we both are.
yeah,
You, it has made you such a resilient guy. Wow, thank you for sharing your personal story.
yeah. I could tell you one thing. It really is. I mean, this is to doctors. This might not sound the greatest thing, and people may not want to hear this, but it's the truth. You know, a lot of doctors don't understand this, and I'm just gonna be completely honest. The mind controls the body doesn't control the mind, and I know that for 100% fact. You
Wow.
know, the mind is more powerful than the body, and the mind could accomplish anything. Like a lot of disease is focused on the body, when the disease should be focused more on the mind. Because with your mind, you actually can heal the body, and it's not a direct correlation. Like, oh, you just fix the mind, the body heals. No, no, it's not how it works. I can explain how it works, but there,
At a
it's
later
it's
time,
it's
we
it's,
will
it's the
interview you
truth.
because one of
Yeah,
my topics of interest is neuroplasticity. And what you're
yeah,
getting towards the point is that our brain actually helps through pathways of neuroplasticity, and there are books
yeah,
written on it. But I would like you to be a guest
yeah,
on that podcast that we talk
yeah.
about
Sure.
neuroplasticity. So that definitely makes you such a unique person in the field of medicine, going through it
Yeah,
at just the moment you graduated. You're full of energy, dreams and passions. You're a young father, and you had to go through it. So may God bless you with good health for rest
thank
of your
you,
life.
thank you.
What is currently your journey of life right now? I don't want to say for you, so just tell me, because you have so many roles.
Yeah,
What do
yeah.
you do right now?
So I'm working basically, full time with Fruitstreet Health and CovidMD to help, Lawrence and the whole team build out this company. You know, to go where to basically we're hoping to change, not hoping, I know we will change the face of healthcare, because this is the future of healthcare, because the future of healthcare is prevention. Prevention is the future of healthcare. And that's where,
Wonderful.
yeah.
So, Ari, I'm going to ask you to divide the part of Fruitstreet and CovidMD and just give us a little bit of 2 minutes on each one of them. What are they doing? What is Fruitstreet? What is CovidMD?
So Fruitstreet is all about prevention.
Okay.
Prevention about specifically diabetes prevention.
Okay.
So as we know, or as some people don't know, approximately 70% of America is overweight, unfortunately, which leads to pre-diabetes, eventually diabetes, and eventually a lot of other chronic diseases. So if we can prevent that to begin with, not only can we save millions of American lives, we could save people from tons of chronic diseases. We can save the healthcare system millions of dollars, the insurance companies millions of dollars, and we completely alter the healthcare system. So that's the basis
So
behind
how is
Fruit
that
Street.
care delivered? What's the model there for Fruitstreet?
Well, basically what Fruit Street does is it's a telehealth solution where we have an online virtual visit where you could basically, through your smartphone, you could take pictures of your food on a daily basis, get
Mhm.
instant feedback on your food from a dietitian. You could meet on a weekly basis with a dietitian to get feedback about your diet and nutrition. You get a free wireless Fitbit and and wireless scale that weighs yourself, so you can keep track of your weight and weight loss or gain, hopefully not, if you're doing the right thing. And keeps track of the Fitbit, keeps track of your activity, your steps, how much you're walking. So the dietitian can help you plan out your day and make sure you're getting the proper calories in versus minus, the activity. Calories burn, calories in, and it's an unstoppable way of weight loss, and it's actually proven model in the New England Journal of Medicine that works, the diabetes prevention program, because when you're monitoring all these factors, there's no way if you follow it, it's impossible to not lose weight.
So this is a company that was started with the intention of changing lifestyle, and they chose the biggest health problem in our country, which is
Yeah.
obesity, diabetes, and they incorporated the dietitian component to it and technology. So we have
Yeah.
the monitoring of weight through the digital devices. They also, you said, give them the Fitbits for people to
Yeah.
record their activities. So that's
Yeah.
another digital impact there. And I believe that this activity tracker, wireless scale, and the dietitian complete that triangle where people are accountable. Has this been recognized by any government authority like CDC or somebody who has said that,
Yeah.
well, this works?
Yeah, we are currently endorsed and fully recognized by the CDC, the Centers for Disease Control. So, which is an amazing thing. We're actually the only virtual online diabetes prevention program recognized and endorsed by the CDC.
Wow, wonderful. Now, is it people have to pay for it? How much does it cost usually?
So, actually, right now, Medicare is paying for this, and Medicare patients can get it for free. They can get the free dietitian visits, the free software, the free Fitbit, the free wireless scale. Not only
Interesting.
that, but health plans are starting to cover it, and employers are starting to cover it.
Wow, this could change a lot of our bigger problems. I hope more and more insurance companies get into it.
Yeah.
My question for you is then I've been also following that CovidMD has originated now as part of the Fruitstreet Health sister company. What is CovidMD?
So CovidMD was a brilliant decision, I would say, by our founder, CEO and founder Lawrence Gerard, to create a solution to respond to the pandemic, because there was, obviously a massive problem, public health problem in America right now, and this isn't going anywhere. Unfortunately, it's really unfortunate, but it's just not going anywhere. There's no treatment. There's no vaccine. Um, people are having difficulty following the quarantine and social distancing guidelines, which is understandable because no one could just lock themselves in their house forever. I mean,
Forever,
it's just
yeah.
not, it's not possible. It's not possible. Human people are not meant to be locked in a cage. So we need some type of solution to help the public with this problem. So this isn't going away tomorrow. This isn't going away 3 months from now. It's not going away 6 months from now. We don't know when it's going away. So he created this solution to help educate, treat, and monitor patients with COVID.
So, Ari, what I'm understanding is that there was a visionary CEO, Lawrence, who, along with some other physicians, started a company with a vision of introducing telemedicine, but use of nutritionists to help. And when he saw the opportunity that people actually really need healthcare delivery in a better and effective way during the COVID crisis, they created CovidMD, and now it's going to be a medical side of treatment,
Yes.
urgent care, and continuity of care model for physicians. How many physicians have joined CovidMD so far?
We've credentialed hundreds of doctors already. We have hundreds of doctors on board. And like I said, like this isn't something that's a shotgun approach. Like, okay, turn it on, start tomorrow. We need it right now. No, COVID's not going anywhere. Unfortunately, I wish I could snap my fingers and it was over. I wish, but we have no treatment and we have no vaccine, and that's the reality. And we need longer term, smarter solutions for this problem until there is a vaccine and until there is a treatment, or that we know people are immune to it. And no one could build a solution overnight for this, and we need a long-term plan, and that's what we're building.
So Ari, I know that there are some other existing companies. People were like, well, we have MD Live or Teladoc. How CovidMD is different? And I know that you can share some ideas about how they're going to deliver care, and maybe their deep down what other things they have in their vision plan, if your company's confidentiality part is, protected. Share with us, how is it different than other two big companies?
Yeah, I mean, I'm not going to go into too much detail about that right now, but
Okay.
I think basically, it's all about being focused more about COVID. Everything else is more focused about, just
So
urgent care.
education
Yeah.
and treating people through their home at their offices.
Yeah, because we need a solution for COVID. It's a major public health crisis, and we need to help the public with it. And the reality is that with an online solution, people can do it from the safety of their homes. And we need something for that. And we need something that evolves as the pandemic evolves. And we're building that, and that's what we're building. And that's what we're going to have.
And as part of this organization, I think you, as a physician leader with others, are seeing that physicians always think about the practicality of delivery of care, right? And that makes us unique because CovidMD primarily investors are all physicians. Or the Fruitstreet,
Correct.
correct? Yeah. So that would be the first. So are you, where are you seeing yourself now from 5 years from now in this telehealth, digital health scenario? What do you think would be happening for you now?
As far as digital health,
Yeah.
for myself, what am I going to do?
Yeah. Are you gonna be part of providing care with use of telehealth as part of your daily routine as a physician, since you see that digital health has come to our doors, knocking on our doors and say, use me now?
Yeah. So the way I'm taught, and the way I'm working on so many different things right now. I'm working on publishing a new book. I have actually 2 books coming out. I'm working on a lot of different things as an entrepreneur and in life. So I take it day by day. I don't live in the past. I don't live in the future. I live in the present. So I look to the future as far as a vision of what I want to see for myself, my family, the world, society. But as far as what I'm going to do on a day-to-day basis, I always stay in the present.
Great. Okay. So share with us that. So what I see is that Ari, you consider yourself an enabler of digital technology for the physicians all across the globe, but you also see yourself as the one that can continue to provide vision for evolution of
Yeah.
care. Tell us a little bit about your book. I know you have written a book about success, and you're a co-author
Yeah.
of a New York Times bestseller.
No, it's
Tell
not.
us,
It's a bestseller. It's not a New
it's
York
a
Times
bestseller.
bestseller.
Okay, it's a
Yeah.
bestseller. Thank you for
I
correction.
will. I will have a New York Times bestseller though. That's coming
So
next.
tell us a little bit about what is your thought process. You don't have to disclose all the
Yeah.
confidential information, but what is your areas of interest with you writing about?
What the last book I did,
Mm-hmm.
the Success Formula book with I co-worked
Yep.
with Jack Canfield.
Mm-hmm. Yeah. What was it about? Who
That
should
that
read it? Who should read it?
well, Jack Canfield is one of the world's foremost thought leaders on success and success principles and personal development. So, I've followed him and all other thought leaders for over 10 years, studied them, read them. I mean, I studied them just as hard as I studied medicine. So,
How did you
so
guys
based,
connected for that collaboration? Just
it's
happened.
yeah, it's difficult to say, but basically, I wrote about my story about what I know about personal development, about never giving up,
Interesting. Okay.
and about why personal development, the law of attraction, and what I've learned in life, and why it's important to never give up, and how it contributes to success.
So, Ari, I wanna wish you best of luck for your upcoming books. Do you see any roadblocks for providing of public health solutions in context of COVID right now, COVID-19? What are the biggest problems that we have as a nation that you are seeing that we need to overcome?
The government. The government, unfortunately, the government and policies are the biggest roadblocks. I think
Okay.
the government's going to decide the health of the future. I mean, if they want to let the doctors let become have if the government wants prevention to be the future of healthcare, then they have to let us provide it. I
Providing.
mean,
Yeah.
they can basically block the doctors from making prevention the future of healthcare by their policies, which they've done so far, which the insurance companies and the government has done with their policies. They've blocked the doctors from giving preventative healthcare, from paying for preventative healthcare, and basically some of the roadblocks are starting to come down and are falling down, but it's on the policymakers and the government to bring down all those roadblocks and let the doctors give preventative care.
Okay, that's thoughtful. That's insightful. Now, what is your advice to physicians who are currently frustrated with these situations? What can we do as physicians? I mean, is there a direction you want to share with our fellow physicians?
Yeah, there's definitely a lot of initiatives out there right now that you could join to have your voice heard. There's I can't think of right now the National Physician Collective. There's a bunch of organizations. If you really large physician
That
initiatives
can
right now.
contribute. So
Yeah,
try look around and
yeah,
just have your voice heard. My
yeah.
question for you is, given the area where you live in, is there a population that you feel are hit the hardest? Your heart goes out to help certain people
Yeah.
the
So
most?
there's a group right now that's basically becoming like a physician union. It's called the Physician Collective, the National Physicians United. And
I've
it started very quickly. There's over 26,000 members already, and they're gonna make a lot of policy change, I think, in America.
okay. So tell us the name again.
It's called the Physician Collective,
Physician Collective. Okay.
also known as the National Physicians United.
Okay.
And
National Physician United.
they're lobbying the country to make change for the better for
For the
healthcare.
better. Yeah, thank you for sharing that source. I will try to post that in our links there. My question was, is there any certain population that you want to bring attention of public physicians that you see are neglected in your eyes, and they should get more care?
I mean, the underserved, I mean, there's a lot of different populations, to be honest with you. I wouldn't just say one population, you know? But obviously, the underserved population, people that don't have health insurance, is a huge problem in America. I unfortunately don't have all the answers for that. I don't think anybody does.
Sure,
You know?
sure. And as experienced person who went through a lot of pain, medications, and recovered through your power of your brain's ability to help. What do you think about how are we approaching opioid crisis in this country?
You know, it's they talk out of both sides of their mouth, and that's the problem. And to be honest with you, I understand what they're doing, but I'm going to speak as a doctor and as a patient right now. And some people might not like what I have to say, to be honest with you. It's great what they're doing because I know so many people overdose and die and abuse and sell, but you know, it was absolutely pathetic, beyond pathetic. I mean, when I was a doctor, a medical doctor with 4 back surgeries, I was in so much pain, I literally wanted to die. I wanted to die. I was in so much pain. I couldn't stand. I couldn't even stand on one of my legs. And I couldn't find a doctor to give me oxycodone or pain medication. I couldn't find a doctor to give me, doctors wouldn't, I couldn't even find a doctor to see me, let alone give me medication, because they thought I was like addicted or something.
Addicted, yeah, wow.
And meanwhile, I had my 3rd back surgery. And I was told by all the top specialists in the country that I need a spinal cord stimulator. Like I had all the documents. Like I'm like, here, the director of spine surgery from Hospital for Special Surgery, who sees all the famous sports players, here's his consult that says I need a spinal cord stimulator. And they were like, and the doctors wouldn't see me, or they wouldn't put me on doses of pain medication high enough. Not only that, I ended up with bone marrow suppression and on a leukemia floor for 7 days from all the medications I was on, because I had bad reactions to some of the non-opioid medications. I was on the leukemia floor for 7 days at North Shore LIJ because
Wow.
I had severe neutropenia because they tried every non-opioid medication on me because they didn't want me on so much opioids.
Oh, I hope all of those are behind you.
Yeah,
But that
everything's
gives us
gone.
a lot of strength and thinking for us to do.
So
How do you?
yeah. So that's the thing. It's, you know, it's a double-edged say. Like you don't want people selling, dealing, drug dealing, you know, overdosing. But the people that really need the drugs now can't even get it. You know, I'm not even joking. Like people that really need the drug, they can't get it.
They can't
It's
get
almost
it.
it's
Yeah.
almost impossible. Almost impossible.
I know. I mean, being at a cancer hospital as one of their pain doctors, I can understand that this is sometimes it's a difference of like quality of life for a few months of life that you're left with. You're gonna live in pain or just be able to get through this. So my last question for you for our professional session is the balancing act. How you're so busy. How are you balancing your life right now between your work and your life? And
That's a funny question. It's a little bit of chaos, I have to say.
yeah,
I think it's always a fine balance of everything, no matter what you do in life. I mean, going through medical school, we all learned this the hard way, probably the first year of medical school,
yeah,
trying to figure out how to do what, how to make it to class, how to study, how to eat, you know, how to survive. The first year internship, we go through it all over again as a resident, you know, how to do it. The
yeah.
first year as a father or a mother, we go through it again, you know, how to take care of the kids. So I think it's always just a revolving syndrome of trying to recreate yourself and figure out how to balance everything out. And when new things come up in life, it takes an adjustment period and then you figure it out.
Well, I think that your last few words are probably a lesson for many of us, a good lesson. You learn to recreate yourself every few years. And
Yeah.
one of my favorite authors, Yuval Harari from Israel, he talks about that the future of the world is only in hands of people who know how to recreate themselves every few years, because the world
Mm-hmm.
is going to change so much we have no idea. and I hope
Yeah.
to read his upcoming books. But thank you so much, Ari. For this session, we're gonna talk about your fun aspect of your life, the lighter aspect of your life in a few moments. Thank you so much.
You got it. Thank you.